let's get started. We lost about 5 to 7 minutes into this meeting. Today's topic is very appropriate for this season. We're going to talk about influenza, also known as the flu. I'm talking about the respiratory flu, not the stomach flu. Let's start with some statistics from CDC. The CDC estimates that influenza resulted in between 9.2 million and 60.8 million illnesses, and about 140,000 to 710 hospitalizations, between 12,000 to 56,000 deaths annually, since 2010. That's a huge number of individuals who are affected by the seasonal influenza. The adults 65 years and older and children under 5 years of age are at higher risk due to their weak immune systems. For 65 years and older, most of these, the pneumonia and influenza-related hospitalizations are for this age group, the 65 years. Comorbidities, they have, so many diagnoses, hypertension, cardiac issues. All these issues add to their weak immune system, and that kind of places them at a higher risk for getting infected with influenza. So let's talk about, just jump right into what is flu, what do you need to know about it, how it spreads, what are the symptoms. I'm just going to go over, just a brief introduction about flu. So the flu is a contagious respiratory illness caused by influenza viruses that infect the nose, throat, and sometimes the lungs. It can cause mild to severe illness, and at times it can also lead to death. How does it spread? The flu viruses actually spread mainly by tiny droplets. These droplets are made when people with flu cough or sneeze or talk. So these droplets can land in the mouths or noses of people who are nearby, and less often a person might also get flu by touching a surface or object that has flu virus on it, and then touching their own mouth, nose, or possibly their eyes. So the onset of symptoms, the time from when a person is exposed to flu virus and infected to when the symptoms begin, is about 1 to 4 days, with an average of about 2 days. The period of contagiousness. Although people with the flu are most contagious in the first 3 to 4 days after their illness begins, some otherwise healthy adults may be able to infect others beginning day 1 before the symptoms develop, and up to 5 to 7 days after becoming sick. Some people, especially young children and people with weakened immune systems, might be able to infect others with flu viruses for an even longer time. So anyone can get the flu, even the healthy individuals, and serious problems related to the flu can happen at any age. But of course, like I said before, people who are 65 years and older, or young children under 5 years of age, are at a higher risk of developing serious issues, health issues related to this infection. So let's talk about symptoms of influenza. Now, I know that, during this season, a lot of people get those respiratory, colds and coughs and all that. But there is a difference between just getting a cold, a common cold, versus flu. If anyone's ever had a flu, you know that it's nothing like a common cold. The symptoms are kind of similar, but they are very, very severe. So let's talk about symptoms of influenza. For nasal and you have the sore throat, the ache, the runny nose, the stuffy nose. There's coughing, gastric issues, nausea and vomiting. Joints are achy. You have extreme tiredness, fever, which is usually very high. Now that is something that you don't see in a common cold, not very high fever. So that is something that we need. Well, I'll talk about what we need to watch out for when we're taking care of our clients. A central headache, that's kind of, those are the symptoms of flu, but you may feel that in a common cold, but when you have a flu, you know exactly that this is not what a regular cold feels like. So here's the difference. Is it flu or common cold? I don't know if you can view my slide, but on this slide, I have this little man with the comparison on each side. Is it a cold or the flu? So of course, we talked about the flu, prominent headache, sudden onset of temperature, which is 102 degrees to 104 degrees. It lasts about 3 to 4 days. Severe aches and pains, extreme fatigue, severe cough, and chest discomfort. Whereas in a cold, you rarely get a headache. The temperature is usually normal. You have slight aches and pains, sneezing, runny nose, sore throat, and mild to moderate hacking or cough. The duration for cold versus flu. Cold symptoms usually clear within 2 to 4 days. You know, I remember my mom always says, when it's a cold, just let it be. It'll be over in about 3 days. You know, flu symptoms, whereas would last from 4 to 7 days. The complications from a cold would seldom lead to a serious secondary respiratory illness, whereas with a flu, it often leads to a serious secondary bacterial infection. It could be pneumonia, bronchitis, especially in the high-risk group. So how do we diagnose a flu? The most common flu tests are called rapid influenza diagnostic tests. These are basically, it's similar to, I don't know if you've gone to a doctor for a strep throat test. They do that rapid swab of your throat, and they have the solution. They check it, and they can tell you within 5 minutes if you have strep throat or not. So that's exactly what they use for a flu as well. A rapid test. They swab your nose and the back of your throat, and within 10 to 15 minutes, they can tell if it is a flu or not. Sometimes there are more specialized testing in the hospital or special laboratories where they send these samples out, and the flu is, they test for the flu. So the results usually take from 1 hour or several hours for the laboratories or the hospital tests. So the question is, if I have flu-like symptoms, will my healthcare provider test me using those swabs? You know, it's not necessarily that your provider will test you for that, only because, you know, the treatment regime does not change whether you test positive or not. So mostly it's the same, the treatment, you know, and we'll get into that. They may or they may not test you. However, if there is an outbreak, you know, a flu, and they suspect, and they're collecting data which needs to go to the health department, they will test you to just ascertain positively that you have the flu. Next section is about prevention and protection, both for yourself and for your client. So number 1 on the list is get the seasonal flu shot. Number 2 is washing your hands thoroughly and often. Keep an alcohol-based hand sanitizer handy. Cough or sneeze into a tissue or your sleeve, and keep surfaces and items disinfected. Some misconceptions about flu vaccines. I know there are a lot of flu vaccines out there, and we hear that people, when they're talking about flu shots, they say, oh, I got a flu shot this season or last season, and I got really sick. And, you know, when I invested more time in researching this, and I learned about this, it changed my opinion too, because I was in that category. Well, a flu shot cannot cause flu, okay? The most common side effects from the influenza, the flu shot, are soreness, redness, tenderness, or swelling where the shot was given. A low-grade fever or headache and muscle aches may also occur. But these reactions, if you had, would last from 1 to 2 days. And the most common reactions people have to flu vaccine are less severe than the symptoms caused by actual flu illness. What about people who get a seasonal flu vaccine and still get sick with flu symptoms? So that happens too. But, you know, once again, in the research, I found out that the flu vaccine only protects against influenza, not any other respiratory illnesses. So you may get a cold, maybe a slightly severe case of cold, and you may think that you have a flu, but it's actually not a flu. It is possible to be exposed to influenza viruses, which cause the flu, shortly before getting vaccinated or during the 2-week period after vaccination that it takes the body to develop immunity. Some people may have been exposed to a flu virus that is very different from the viruses the vaccine is designed to protect against. The effectiveness of flu vaccine also varies in how well it works in some individuals. So if you're at a higher risk, a high-risk group, you know, you have a higher chance of developing or getting the flu if, you know, in that period when you receive the flu vaccine and it's waiting to get effective. What's the treatment? So if you've caught the flu, what is the treatment? Primarily a fever reducer agent you need to take, Tylenol, something like that. For cough, they say use a cool mist humidifier to increase air moisture. Sore throat, you gargle with warm or cold double-strength tea or salt water, or use over-the-counter throat lozenges. For a runny congestion, you use salt water drops or over-the-counter spray or oral disinfectant. For muscle aches, you use warm compresses. Other than that, of course, if you have the flu, stay home until you have been fever-free for at least 24 hours. And that is fever-free for at least 24 hours without any medication. Plenty of rest helps your body fight the flu. Increase your fluid intake. More liquids you take, the better it is. Drink at least 8 glasses of water a day. Other than that, there is a common antiviral drug which are used to treat the flu. The most common that I've seen is Tamiflu. It's an oral antiviral drug, and the most common side effects from that is nausea, vomiting, or dizziness, and you usually take it with food. So as a caregiver, what is our role in taking care of ourselves and our clients during this flu season? So if your client or you show any signs and symptoms of flu, you must seek out your provider. You must go and see your physician as soon as possible. If and when your client is diagnosed with flu, number one thing is to control the spread. You control the spread by protecting yourself and the client. Frequent hand washing, using gloves, wearing a face mask, very important. Disinfect living area frequently. Encourage drinking plenty of fluids and taking medications as prescribed by the physician. Encourage staying at home and getting plenty of rest. Avoid public places. If going out, wear a mask. Well, the CDC recommends staying home for at least 24 hours after the fever is gone. We talked about that, except to get medical care or other necessities. So you should try to limit your access. You should try to avoid going outside only unless if it's absolutely necessary. Fever should be gone without the use of a fever-reducing medicine such as Tylenol, so at least for 24 hours. Call 911 only if there is a true emergency. So CDC recommends that you do not go to the emergency department or anything if you have these symptoms, unless if it is a true emergency. So for your clients who are 65 years and older, if they do get a flu, just look at their symptoms and see if it's something that the doctor prescribed medications for. You can avoid going to the ER. However, there are true emergencies such as severe shortness of breath, or if they complain of chest pain. Those are emergencies for which you will definitely call 911 and take them to the emergency room. There are some regulations that state health departments, usually send out during flu season. Here in New York, the flu season generally runs from October to March. Those are CDC guidelines. That's the CDC season for flu. So during the month of October to March, New York State Health Department has the following regulations. All direct healthcare workers are required to complete a vaccination status report, which includes whether you received the vaccine or not. If you have declined the vaccine, that has to be documented, and there are certain things that you have to do while you're caring for your clients. So vaccinated workers will need to provide proof from physician of their vaccination for the current year. Every year you have to get a new flu shot. Flu shot from last season does not count. If vaccination is not received due to medical reasons, documentation from physicians stating the reasons should be provided. And workers who have not vaccinated are required to wear face masks while providing direct care to patients during flu season. So that's something that I know in our office we've mandated the aides. We've collected the vaccination status report, and the aides who did not get vaccinated are required to put a face mask while caring for the clients. New Jersey, Connecticut, and Florida state health departments, they all follow CDC's flu prevention and protection guidelines. I was not able to research and get any specific details about wearing a face mask, and if we do have someone on the call, well, I know Linda, you're here. Anyone from New Jersey or Connecticut, please feel free to jump in and say if there is anything different from what New York State regulations are. Once again, getting the seasonal flu shot, washing hands frequently, alcohol-based hand sanitizer, coughing or sneezing into a tissue or your sleeve, and keeping surfaces and items disinfected. Those are the regulations. If there's anything else, I know that in New York we have to wear a face mask. I don't know what about Florida, Connecticut, and New Jersey, if that applies there. And that brings us to the end of our presentation. I'm open for questions.
This is Linda Spencer. It's not a question, but just a comment that yes, that's true here in Florida. The guidelines from CDC are the same, whether someone working in a hospital or in a home health setting. So those recs are pertinent down here as well.
Oh, perfect. So wearing a face mask if you're not vaccinated?
Yes, that's correct.
Okay, perfect, perfect. Any other comments, any questions?
Joy, I'm curious about, Sadina, I'm curious about your experience working in home care, about how often you're actually seeing the flu in our clients. I know you presented statistics, kind of general statistics. I'm just wondering in terms of our own population.
I have to say that caring people or my other previous employers, I saw more of pneumonia than flu. So I'm wondering if, patients actually had the flu and then it got severe and they ended up having that complication of pneumonia, or whether it was just, not a flu or, just a simple pneumonia that they had. So, usually clients of that age are very good at receiving flu shots and the pneumococcal vaccine. But then again, this is, they have the weakened immune system, so they are at a higher risk. And what happens is the flu shot, the vaccine, is actually, every year it contains, it's made specifically for a single strain of that influenza virus. So there are several other viruses that are out there that mimic the influenza virus, the flu virus, and they could get that, and it appears as if they have a flu. Does that sort of answer your question?
Yes, thank you very much.
Any other questions?